afternoon, everyone, and welcome to another edition of the TCR Dialogues. We are excited today to bring you someone all the way from Washington, D.C. in the White House. Today, we have with us Dr. Cameron Webb, JD, who is the Senior White House COVID Advisor for COVID Equity. And we have with us today Antoine Searat to do the interview. This is a very special treat. We're looking forward to hearing what you both have to say. I'll be back later on to give some announcements. Thank you, Antoine, and thank you to our guest, Dr. Webb, for being with us. We look forward to this conversation.
Thank you, John Thompson III. Thanks for all you do, and of course to the staff at the Christian Recorder. And welcome to all of you. As always, please don't forget to drop your name, your Episcopal district, who your bishop may be, your elder, anything else you want to tell us or let us know about where you're visiting or where you're watching from around the world. Shout out to my home bishop, Bishop Samuel Green in the 7th Episcopal District, and of course my aunt and uncle down in the 9th Episcopal District who are in the middle of conference, Bishop and Supervisor Seawright, and to the Senior Bishop and Supervisor Richardson. To all of you who are special in your own way, thank you for joining us for what I hope to be a very exciting and informative episode. I am so blessed and thrilled to have one of the Commonwealth's very own, just a unique, special brother who grew up in Virginia. Father was an HR manager. Mother was a public school speech pathologist, a graduate, a medical school graduate, and a law school graduate of the University of Virginia, an alpha man, served in the Barack Obama's historic administration, went on to run for office. God had a different set of plans for him after the 2020 election, and now, most recently, he was appointed by the 46th President of the United States as a senior White House advisor on COVID-19. And I'm just more so than anything I can talk about in his resume, I'm proud to call this brother a friend. And Dr. Cameron Webb, thank you for all you've done. Thank you for what you're doing to help pull this country together.
Well, thank you so much for having me and for that kind introduction. It's a blessing to be with you all today and to just, get into the info, make sure that we're having the right conversations and I'm just excited to be with you all today.
Dr. Webb, as you know, this pandemic has really ripped through the fabric of who we are as a country, but it really has drawn blood from communities that look like ours. Can you talk about what this pandemic has meant and what it has done for communities that look like the ones you and I grew up in?
Oh, it's been absolutely devastating in so many ways. And if you go back to the earliest days of this pandemic, not necessarily, when the very first case came in January of 2020, but by the time we got to April, we were already seeing differences and disparities in the rate of COVID cases, rate of COVID hospitalizations, and COVID deaths in the Black community. We started to see that death toll really start to have an impact. I remember seeing that 70% of the deaths in Milwaukee were from Black individuals. In the state of Louisiana early on, 70% of the deaths were again in the Black community. So we saw that this was having a disproportionate impact. I saw it from the front lines. I work clinically as an internal medicine doctor, a hospitalist, working on a COVID unit at my hospital at the University of Virginia. And just seeing disproportionately the patients I was taking care of look like me and come from communities like mine. And so it's so important that we took a step back and said, well, how can we address this? And we start off by saying we need more information, we need more data, we need to understand the size of the problem, but we can't wait for that. We need to make sure that we're speeding resources to those communities. First resources were things like personal protective equipment, were really the tools for folks to stay safe. But remember, once that vaccine came around in mid-December, we finally had that source of hope that this is something that can prevent us from being hospitalized and from dying. And then we had the great and tall task of making sure that we are cutting through the historic inequity, the historic mistrust and contemporary mistrust in communities of color, because medical system hasn't always been fair to us. And certainly we had to make sure that we were ready for that moment. We were ready to step in and get people the resources that they need. And so, certainly this pandemic has had an unequal toll on the Black community. But I think that at the end of the day, this is going to be the story of how the Black community rallied together, how faith leaders took a leadership role by offering vaccines in their sanctuaries, how community-based organizations came together to make sure they were supporting the people they served, how local physicians and nurses and public health professionals really went above and beyond to make sure they were talking to everybody they could in the community. That's the reason why Just a couple of weeks ago, we saw for the first time the rate of vaccinations among adults. 70% of Black adults are vaccinated, 71% of white adults, 73% of Latino adults. That's nationwide. And that's an incredible statistic because we've narrowed a lot of those gaps that we saw earlier on. So we're making progress, but the job's not done. There's still a lot we still need to do. We have a lot more people we need to continue to engage with and talk to. We have to make sure that everybody ultimately has what they need to not just survive, but thrive through this pandemic.
Dr. Webb, I jokingly say this about you in private, but you have more letters behind your name than money I have in my bank account. So you're a very well qualified young man. And for those who have questions or question the idea of science and all the things we've been doing our best to inform people about around the world when it comes to vaccines and the pandemic, give us some background color to your specific background. I know I gave you a Sunday school version introduction, but you have an incredible story. You are a man of faith. I know that myself, but give us a Sunday school version, a little bit about who you are and kind of your background.
Yeah, absolutely. I've been passionate about taking care of people since I was a kid. For me, my interest in medicine came from having a Black physician who took care of my siblings and I growing up. And I always say you can't be what you don't see, and having that experience of seeing a Black man in a white coat who was serving his community that way, Dr. Timothy Yarborough in Virginia, where I'm from, that had a huge impact on me. And so from there, I decided I wanted to be a physician. But my parents are from Louisiana. They're from the South. They grew up telling me the experiences they had, telling me their participation in different aspects of the civil rights movement as young children, and the ongoing struggle and work towards social justice. And I decided to put the two together. I wanted to both fight for the health and well-being of my community, but at the same time, fight for social justice in that space. And that's what led me to pursue both medicine and law concurrently. And that has taken me from Virginia to North Carolina, to Chicago, where I got my law degree, to New York City, where I did my residency training, and then to the White House, where I was doing work on social justice through the My Brother's Keeper initiative, and continuing to find ways to connect health and social justice. Been serving as the Director of Health Policy and Equity at the University of Virginia for the last 5 years. And then, I think in this role, coming into the Biden administration, I'm able to bring a lot of those back together because I've been taking care of COVID patients. I've been helping to get testing events in my community, a community with a large Black population, in Charlottesville, Virginia, who's been historically and in the present day often underserved. And so getting those resources where they need to go, I work with, and we worked with faith leaders actually, with the AME Church to have that first testing event, in our community in Charlottesville. And it was so important for us to find those spaces that people trust. And I know that from experience. And so I'm working in the hospital this weekend, right? I think my passion, I feel called to be a healer. I think that's what God has called me to do. And you can do that in a lot of different ways. I do it clinically. That's one of my goals, but I also try to do it in policy spaces as well. And I'm just going to keep fighting. I think that's the goal. And I've got great mentorship, leadership folks who've shown me the way through the years. My pastor, my friends, I think those are things that have made a huge difference in continuing to shape me that way. But I think we all need to look and say, well, what more can I do? We're called for such a time as this. And I think this is exactly kind of how we serve.
Dr. Cam, talk about the vaccine. You've been to the barbershop. You, like me, have been around the country, from people saying the eyes are going to pop out of the head to they're going to grow a fourth leg, to it's going to, for women, it's going to deal with their fertility. I mean, you've seen the myths, you've heard about them, you've read the disinformation, misinformation. I'll ask for forgiveness after I say this, John Thomas III, but you've also heard the lies that exist around the vaccine. Talk to us about the vaccine, debunk some of the myths, and talk to us about why it's important for men and women and children of age who are eligible to get vaccinated.
Well, Antoine, it would be a 2 or 3 day seminar for us to walk through all the misinformation that's out there. I was actually down in Raleigh, North Carolina earlier this week, meeting with a group of young folks, teenagers at a Boys and Girls Club. And I asked them, what are some of the most incredible things that you've heard people say, just, myths about the vaccine? And they started to raise their hand. And one said that you're going to grow a third eye. Another said that the arm that receives the vaccine is going to fall off. Others said it would turn you into a zombie. People said it would put a microchip in your body. Certainly they raise the question about fertility, and it ranges from the absolutely unbelievable to things that you can understand why it would give somebody pause that's concerning, but that's no less untrue than that it'll turn you into a zombie. And I think that that's where, I think spending a lot of time in community is so important to me. It's the reason why I travel so much and engage with communities so much, because I want to hear what they're seeing, what they're hearing, what they're concerned about, so that we can address those, through the bully pulpit of the White House. So you're right. There are a lot of myths. There's a lot of misinformation. And I think one of the top myths that I hear is that the vaccine was developed way too fast. It can't possibly be a good vaccine. And that's, just quite frankly, not true. I think a lot of people will say, well, usually it takes a couple of years to make a new vaccine. But if we still were limited to the technology that was used to make vaccines back in the 1960s or 70s, if we were still using that technology, we wouldn't be advancing as a society. In 2021, we should have new tools. And this messenger RNA vaccine platform that Pfizer and Moderna vaccines use, yes, they're new platforms, new tools for vaccines. They've been under development for decades. That messenger RNA platform, the research on coronavirus is underway for decades. They put those two things together in a crisis moment. We infused a tremendous amount of federal resources to speed the effort to develop. And then every single pharmaceutical company was working on a COVID vaccine, where typically it's one or two companies, maybe three, that are working on any particular kind of vaccine, who have the wherewithal, the interest to do that. Here, every company was saying, well, we want to give it a try too. And so, it made sense to me that we would get this done in 9 months, when you had that infusion of resources, when you had the culmination of 2 decades of research meeting the culmination of several years of coronavirus research. So as a scientist, the timeline doesn't surprise me or concern me in the least. What it comes down to is, did they make a safe vaccine? And where I always tell people is, we have not the gold standard, not just here in the country, but in the world for the approval of new medications. That's the Food and Drug Administration, or the FDA. They have the most rigorous process that exists for vetting a new intervention, a new drug or vaccine. And the Pfizer vaccine received full FDA approval, right? So it's just as trusted, just as trustworthy as the blood pressure pill that you take, the diabetes medicine you take, the asthma medicine. They all have the same stamp of approval. It's not a sub stamp, right? It's no less valid, no less valuable, and no less important to your health and well-being. And so that's one thing that I like to stress to people. I trust that process because I know I've spent years understanding from a policy perspective how many roadblocks there are in that process to get a vaccine over the finish line and fully approved. It's a really high bar, and it gives me a lot of peace. And I received the Pfizer vaccine. I feel very comfortable with the vaccine I received. Was really, truly, and thoroughly vetted. Another question I get really often is the fertility question. Is it going to impact your fertility? There's no scientific basis by which we would think it affects fertility, any more so than the chickenpox vaccine that your kid got, or the measles, mumps, and rubella shot that your kids got. There's nothing about this vaccine in particular. And people say, well, what's in it? And just to dovetail those two, and when I'm asked what's in the vaccine, I'm like, I'll tell you, right? It's messenger RNA, right? So it's the message itself, and that teaches your body how to make that spike protein so it can learn how to fight it, right? So the spike protein is a part of the virus, but it's not the whole. So the spike protein alone can't infect you. It can't give you COVID. There's no way to get COVID from the vaccine because it's not coding for an entire COVID virus, just the spike protein itself. It's almost like if you see a man who's wearing a baseball cap, it's just coding for the baseball cap, not the whole man, right? So I think that's the way to think about it. And I think the way to think about how it trains your body is, let's imagine that man is wearing a very distinctive baseball cap. It's a bright purple and yellow Los Angeles Lakers cap, and he's the only person who wears it. And so if you see somebody wearing that bright purple and yellow cap, you can say, oh, that's probably, John, who I know so well, who always wears that hat. Similarly, the spike protein is only on this coronavirus. And so it teaches your body, if you see this spike, you know that it's that coronavirus. That's the way that it works at a fundamental level. That's the key ingredient. But messenger RNA breaks down really easily in your body. It's not it's not stable enough to last in your body for long periods of time. And if it weren't protected in some way, it would be out of your system completely within a week or two. And so the other ingredients are things that help the messenger RNA get to the cell so that it can do its job. And that's things like a lipid layer. So lipids are fats, and they just help stabilize it and keep it protected while it's traveling through your body. Salts, which help with the acid-base balance so that it doesn't break down on its way or change your body's pH. And then sugars, because at cold temperatures, as the vaccines are stored, the lipids would stick together without sugars. So those are the ingredients in the mRNA vaccines. It's really important for folks to know. There's no other hidden additives. It's very clear. It's very transparent what's in this vaccine. And again, as a scientist, as a physician, as somebody who's been involved in administering vaccines for a long time now, there's nothing untoward about the ingredients in this vaccine. I think that's an important thing for us to walk through. Those things are very commonplace in vaccines, those stabilizing pieces like the salts, the sugars, the lipids. So I think the important thing for folks to know is that when you put that all together, you end up with a vaccine that works, but that doesn't have any way to do things like impact your fertility. And I know exactly where the myth came from. It was a scientist who had the theory that if there's a similarity between the spike protein and a protein that's in a woman's placenta called syncytin 1, then it's possible the vaccine would attack the woman's placenta. Well, they did studies to see if they were sufficiently similar, and those studies proved that it wasn't. We've looked at thousands and thousands of women who became pregnant after getting vaccinated, who were vaccinated in the first trimester of their pregnancy, and we've seen their outcomes are the same as women who were never vaccinated at all. And so again, all the fertility questions, they've been answered. It's the reason the American College of Obstetrics and Gynecology has come out with a formal recommendation that pregnant women should get vaccinated. Not could, not can, but should get vaccinated because of just how damaging COVID, the virus, is to pregnant women. And I think that's a big deal because if you think about it, and this is where I'll pause, obstetricians are some of the most sued individuals in the healthcare enterprise. Not to get into the litigation, but it's a high stakes field. And for that society, the American College of Obstetricians and Gynecologists, to say pregnant women should get vaccinated, what they're saying is that is the standard of care. And if you are not recommending that pregnant women get vaccinated, then you are deviating from that standard of care and putting yourself at risk for litigation. And so I think that's a really important thing to know, is that the new standard of care, just like telling them to take prenatal vitamins, telling them to get, every month get those checkups, all the things that your gynecologist, obstetrician has told you to do for a long time. The new standard of care includes making sure that you're vaccinated against COVID. And that's so important for folks to know. So there are a lot of myths out there, but I think the key is having these conversations where you can cut through those myths. There's no microchip that's in there, right? If we wanted to microchip you, we'd use one of these, cell phone. It's way easier than trying to put a microchip in a very tiny amount of liquid, and you keep it on you all the time. So I think that the fact of the matter is that's just a silly proposition. And so there are a lot of different myths that are out there, but as far as I can see, I haven't found any of them to have any shred of truth. I think some people put them out there to confuse us, and often just to make things more challenging. And I think that some people just pass on things that they heard and don't even realize where it came from. But that's why these conversations are important.
Dr. Cam, I know we have a limited amount of your time, so I ask you to give the Sunday school versions of this for people who have a pre-existing condition, those who are taking other medications. What advice do you give them as it relates to being vaccinated?
Well, always talk to your provider, right? I know well enough not to give medical advice to people I've never met, but I think that by and large, if you have pre-existing medical conditions, you're at greater risk for significant or severe outcomes with COVID-19. So you are exactly the kind of person who should be getting vaccinated. If it's something like diabetes, high blood pressure, any kind of heart disease, asthma, obesity, right? The range of chronic conditions, you should be getting vaccinated because your risk of requiring hospitalization or ending up dead from COVID is much higher than a young, healthy person who has no medical issues at all. What's scary about this virus is that even a young, healthy person with no medical issues at all Some of them end up in my hospital on my COVID unit, requiring 15 liters of oxygen, unable to breathe, having to go to the ICU, and unfortunately, some of them die. And it's hard to tell exactly why some people have that reaction and others don't. And let's say it doesn't get to the point of hospitalization. So many people end up with lingering symptoms, whether it's the loss of sense of smell or taste, it's the mind fog, it's the fatigue, the severe fatigue, the trouble with breathing. Those are all things that people have been a little less than 1/3 of adults who get COVID complain of some lingering symptoms several months after the infection. So, I think that for folks with pre-existing conditions, by and large, I would say the great and incredible majority of them should get vaccinated to protect them. Of course, have those conversations with your provider, but at the end of the day, the vaccine is most important if you have any other health conditions, just so that you don't get really sick with COVID.
Dr. Cam, talk about vaccine effectiveness, because we've seen people who have been vaccinated who've still gotten the virus. Some have died. Talk about vaccine effectiveness, because that feeds into some of the myths as well. Oh, even if I still get vaccinated, I still might die, or I still may get the virus.
Yeah, so if you look at it, about 79% of American adults have been vaccinated. We're down to only, so if you look, we've got well over 200 million folks who've gotten vaccinated. What's interesting there is that anytime somebody has a breakthrough case, breakthrough hospitalization, or breakthrough death, it's newsworthy and it's tragic. There are lots of reasons why that happens. Some folks who have compromised immune systems, the vaccine isn't quite as effective in getting enough antibodies to protect them. And that's why we've begun recommending a third dose for folks who have compromised immune systems. There are so many different reasons, and no vaccine is 100% effective. But if you say, like we learned, the messenger RNA vaccines, Pfizer and Moderna, were 94, 95% effective. If you take that 95%, that means out of 100 people, 5 people, would still get sick. Out of 100 million people, that's 5 million people. Out of 200 million people, that's 10 million people, right? And so to hear that up to 2 million people could still get, up to 10 million people could still be sick with COVID, even though they're vaccinated, sounds like an incredible number, but it's far less than 200 million. Right. And so I think you got to put that in its proper context first and foremost. The vaccines are incredibly effective. We've seen just the rate of COVID deaths decline so precipitously that we know the vaccines work in preventing death. We know they work in preventing hospitalization, but they also are very effective at preventing COVID cases. So you may still have some breakthroughs, but that's rare, and you're far less likely to get COVID if you're vaccinated than if you were not vaccinated. The other thing is that now the conversation around boosters is really important because, Dr. Fauci's talked about this very recently. We have new studies that have come out that show that with that booster, folks are almost 11 times less likely to even get cases of COVID, especially if they're at that time period. So there's a lot of science that tells us the vaccines are incredibly effective. It's the reason why so many people are encouraged to get them.
Dr. Cam, two things. So one, there's been a lot of questions about who can get vaccinated in terms of age and what some of the latest approvals are, number one. And number two, this idea of mixing vaccinations when it comes to the boosters or the second shot. Can you address those two things?
Yeah, so in terms of boosters specifically, I think that's the crux of the question. A lot of that is coming out in the current days. There's actually a meeting today about that. So before today, we would say that it's for folks who had the Pfizer vaccine, who got it at least 6 months ago, who are older than 65, have chronic medical conditions, or live or work in a setting where they're more exposed to COVID. That's who is eligible for boosters. We think that what we've seen from the FDA, it sounds like it's going to be something similar. That's going to be the recommendation for Moderna, and then it sounds like for Johnson & Johnson, that recommendation would be everybody who got Johnson & Johnson would be appropriate for a second shot. In all three instances, it seems like it's going to be effective. I don't want to get in front of the official recommendation from the CDC. I know that's going to be coming in a matter of hours, so I'm waiting for an alert to pop up on my phone to hear exactly what they say, and of course, then the CDC director will come out. But the good news is, by probably this time next week, right, we'll probably have recommendations for boosters for any kind of vaccine that you've gotten. The key is making sure you're keeping track of which one you got. And then there's also going to be new recommendations on mixing and matching. The early signal looks like that's going to be something that's going to be okay. But again, just wait for those formal recommendations. If you get confused, right, if there's a lot of information out there, always go to a health professional and say, hey, here's what happened with me. In my case, I got my first shot on December 17th, my second shot on January 7th. Both of those were Pfizer. What are my options in terms of boosters? When should I get it, and what vaccine should I get, right? And so have that conversation with a trusted health professional. They can help guide you in the right direction. So that's where we are with boosters, but there's going to be some additional information coming out in the coming days.
Dr. Cam, what about the children? There's a lot of discussion about kids and ages of being vaccinated. Give us some background color to our children and where we are with that.
Well, I'll start with the personal perspective on this. My own babies, my two kids are 10 and 6. So they're too young to get vaccinated as of today. But there's some new data that have been submitted by Pfizer to the FDA. The FDA is going to be reviewing those data. And what the company is saying, what Pfizer is saying, is that these data suggest that it's very safe and effective for kids 5 to 11, of whom there are 28 million kids in this country between the ages of 5 and 11. And it's saying that it's safe and appropriate for them to get vaccinated as well. So the FDA is going to review that next week on the 26th. And then just a few days later, November 2nd and 3rd, the Centers for Disease Control is going to review it. And once they do that and make a recommendation to the director of the Centers for Disease Control and Prevention, well, that's when vaccines for kids would become available. So stay tuned for that. Really, that first week of November is very likely that you'll get a decision on pediatric vaccines. What the administration has said is that we're planning for it, right? We want to be prepared just so that if they say, hey, vaccines are a go, as soon as the FDA says that it's approved from their perspective, we're going to allow states to start ordering vaccines so they can have those on hand for kids. And then as soon as the CDC says that it's okay from their perspective, we're going to allow folks to start signing up to get vaccinated, and or at least states and localities will, to get their kids vaccinated. And so, as I would tell any parent, right, keep a close eye on the data that comes out, on what you hear from the FDA. As a parent, it's my job to make sure I'm keeping my own babies safe. So I'm going to be keeping a close eye on making sure the vaccines are safe for kids their ages, and making sure there's nothing there that gives me pause. I don't blindly accept any recommendation. I wait and see what the data says and what the experts say. And I think that we'll hear that in the coming days. But very likely by that first week of November, we'll have a clear determination on vaccines for kids. And the last thing I'll say on that is, from an administration perspective, we want to center that work around getting kids vaccinated on those kids who are the hardest to reach, whose families have been the hardest hit by COVID, and who are facing some of the highest risk based on rates of COVID in their communities. And so that's really where we're starting. We're making sure pediatricians have it, but also health clinics, federally qualified health centers have the vaccines. We're making sure that school-based clinics will have the vaccines. We're making sure that large hospitals will have the vaccines. We're making sure that we're getting vaccines in other key places where folks can access them. So those are kind of our plans. But again, more information to come in the next couple of weeks.
We certainly want to be able to eat turkey and dressing together this year, and be able to open Christmas presents together. So if y'all can make this happen, it'll make people in the South a whole lot happier, Dr. Cam. Cam, talk to us briefly about what faith institutions and leaders can do to make certain that we cover our bases or cover the ground as we try to really mitigate this virus and get more people vaccinated and educate people more.
Yeah, I think you are the eyes and ears in every community. You're such a trusted space, and you're often going to be the first ones to hear when a rumor or some misinformation is being spread in your congregation. Invite local, Black doctors into your church to speak, at service, to give a little bit of insight to your, to the folks who worship with you. Because it's so important that the community hears from people who look like them. It's so important the community hears from people that they trust. And you can, cut right through a lot of the misinformation just by bringing that trusted messenger into your trusted space. So that's one thing I think you could certainly do to help. So many of you have used your premises for vaccination. So just by partnering with the local health department or partnering with the pharmacy and saying, hey, we're going to have a family vaccination day, the such and such date in November, because we want to make sure that all of our families can come together for the Christmas holiday. And you can do that, right? You can put something like that together. And if kids 5 to 11 are eligible to be vaccinated, you can envision having an event where the youngest kids are getting vaccinated, the teenagers are able to get vaccinated, the parents are able to get vaccinated. At this point, 95% of adults in this country who are older than the age of 65 have had at least one shot. So we know the oldest adults are largely vaccinated, but make a family thing out of it. Make sure you're getting good information out. I think we certainly don't want to take advantage of that trust. That trust is earned, and it's earned because you all are you're really intentional about what information you share and the way that you engage with people. But I think that I feel very, very confident in the safety and the efficacy of these vaccines and how critical they are to us ending this pandemic that has hit our community so hard. And I want to say really quickly, Antoine, one of the most powerful experiences I've had was getting the chance through the Black Coalition Against COVID to meet some of the families, the descendants of that Tuskegee syphilis study. It was conducted from 1932 to 1972. And what's amazing is that the grandchildren of some of those men who were in the study, some of them went on to become doctors, went on to become scientists, public health professionals. They went on to be really motivated by ensuring that kind of atrocity never happens again to any community. And they came together and said, this vaccine is nothing like Tuskegee. They said, in fact, in Tuskegee, what happened is that they withheld life-saving treatment from our fathers and our grandfathers. But the vaccine is that life-saving intervention. And we can't let ourselves get hit hard by that atrocity twice, right? We can't let it beat us twice or hurt us twice, because the legacy of Tuskegee is that now there are all of these ethical requirements for any kind of development of a drug or development of a vaccine, the testing. And that is because we saw that our country can fall far short of ethical goals. Now we have a vaccine that's literally saving lives. And if because of what happened in Tuskegee, Black people are less likely to get that vaccine, well, then we're being harmed by that legacy yet again. So they were imploring everybody, go out there, make sure you are also getting protected the same way that everybody else is, because the science is good, the safety is good, the efficacy is good. These vaccines are our way to save our lives through this pandemic. And I think hearing that from the descendants of Tuskegee, really powerful. And that's something that you all can find on the internet. You can just search for descendants of Tuskegee and COVID-19 vaccines. They've got a series of great videos talking about just that, and feel free to share that with your congregations as well.
Dr. Cam, I know you have much business to do as you wait on announcements to come. I know you have put aside a lot of things to join us here at the Christian Recorder, and I'm so thankful for your friendship. I'm thankful for your leadership. I'm thankful for what you're doing literally to hold this country together. And I'll see you soon, Dr. Cam. Thank you, man.
Thank you so much for having me. Y'all be blessed and take care.
Okay. John Thomas III, I'll turn it back to you, my friend.
Thank you for being with us. Thank you for spending your time with us today. For the See It Right, thank you as always for bringing us this great guest. And we look forward to having more dialogues over the next few weeks. It is my delight to tell you that on Sunday at 5 p.m., we will have our dialogue with the Right Reverend Marvin Clyde Sanders II, the 140th elected and consecrated Bishop of the AME Church, who is also, and I'm proud to say, the first Morehouse graduate elected to be a Bishop of the AME Church. That dialogue will be at 5 p.m., and he will be interviewed by our own Chuck Hobbs. We also want to give a special shout out to Ms. Aisha Daniels, the daughter of Bishop Daniels, who is also the homecoming queen for Howard University. That's right. She is the homecoming queen for Howard University. I believe their homecoming is this weekend, and we are delighted and excited for her. So as we wrap up this broadcast today, we, of course, as you know, over the last few months, we've been sharing COVID videos. We want to also highlight the work of the International Health Commission. So as we close, we want to again play this video from the International Health Commission. Well, not from the International Health Commission. It is from our partner with Values Partnerships that features the voice of the person I like to call one of my pastors, Reverend Anthony Sinkfield, PhD, who's the voice you'll hear in this COVID vaccine PSA. Remember, the COVID is still real. Hope that you govern yourselves according to what you've heard today. Pay attention to the resources from the International Health Commission. Go visit their website and Facebook page, and we will see you again next time.
It was made to save game nights and marquee lights. Tuesday Night Live, good vibes, and the Sunday drive. It was made to save family meals, turkey naps, and taffeta. It was made to save 9 to 5s and just being able to provide. It was made to save the lifesavers. It was made by the best among us to be effective. The COVID-19 vaccines were made to save. They were made to save us.